Good morning, everybody. Welcome back to our weekly speaker series, Enabling Tech in Action, that we're doing as part of the Arkansas DHS grant project and pilot program. Today, we've got Alaina Gallagher, who's going to be talking about medication management. I think you all know that Alaina is one of the subject matter experts on this particular project. She's formerly the CRO of Dose Health. That's an assistive tech company dedicated to medication management. In addition, she currently serves as the executive project manager for the ARRM Innovation Grant, where she leads efforts to promote awareness and accessibility and utilization of assistive tech and remote support in Minnesota. Lots of Minnesota-ness to Alaina, as you'll see. And she serves as a business consultant to Next Gen Assistive Tech, assisting residential service providers there. And then also she's a co-owner and chair of Minnesota Networking and Education for Assistive Tech, or MNNEAT. And they're a tech-focused group collaborating on Minnesota's DHS to provide education and guidance and resources on assistive tech and remote support. And she's a fantastic co-worker and project partner as well. That is not on her bio, so I'm adding that piece. Before I turn it over to Alaina, we are also going to have a vendor spotlight today from Grandview. And so please stick on. At about 45 minutes after the hour, we will be kicking over to them. As you come up with questions for Alaina or for the folks from Grandview, please put them into the chat and I will work them into the conversation as we go. Alaina, it's all yours.
Awesome. Let me share my screen real quick. All right. And I just learned that I can do this while still looking at you, which is awesome. I apologize ahead of time. My cat also wants to be a main presenter on this, so she might jump in and give her take on medication management stuff. Thank you for the intro, Paul. That was wonderful, and you are a great coworker to work with as well. I certainly love working with you. So medication management is probably one of the areas that all of us are extremely familiar with. It's probably something that you see with the majority of the people that you support every day. So I just wanted to say kind of what we're going to cover today. I always like to start with med reconciliation, and we'll get into that some more about why, and then establishing routines and the technology solutions. So let's get started on exploring the different strategies for medication safety and all of that fun stuff. So one of the biggest things is that because med management is such a standard in many, many people's lives, I always try to flag it and say that this is a really good area to look at for independence. For many, many people, they have had assistance or had somebody doing their meds for them since they started taking medications. So looking at ways to ease into how they could gain that independence, or for somebody who's transitioning to needing medication for the first time, or has had a family member supporting them but previously did it on their own, looking at, are there assistive technology solutions that could help the person start managing on their own again? Just finding that area, since it is something that happens typically daily, typically multiple times a day for many people, getting that independence back can be really, really key. And as Paul mentioned, I used to work for Dose Health, which is a medication management company that has a medication dispenser. And one of the things that we saw is commonly, and this is actually how I got into the field of general assistive technology, is starting with meds, because that was simple and that was structured. It was a gateway to many, many other assistive technologies for folks. As people would start there, they'd gain that confidence and then start asking for technology and independence in other areas of their lives, which is really fantastic. So starting with medication reconciliation. So many of you guys are obviously working very, very closely with the individuals that you support on staying on top of their medications, especially if they're living in a community residential home that's fully supported, where meds are being administered by staff. But for many people who don't live in a community residential setting, or don't have kind of 24/7 support, or maybe are receiving support from caregivers, a lot of times medications are being prescribed by different providers in their lives. And while they might have their medication list listed somewhere, it's maybe not always fully looked at or fully considered. So med reconciliation is really, really important to create the most comprehensive list of somebody's medications, what they're taking, when they're taking it, what the potency level is, what their dosage is, all of that. And one of the things that I really like to stress with this is, even if it is that you are working with somebody who has a pretty structured med schedule and you're feeling very good about it, med reconciliation can still be a good thing because it allows you the opportunity to talk with a pharmacist or a doctor, whoever you're going to do that med reconciliation with, and talk through, hey, we find that this person is doing great with their evening and morning meds, but that afternoon med is really difficult. And sometimes that's just not considered. Honestly, like when doctors are prescribing medications, they're thinking about, hey, we've got this problem and this medication can solve it. They don't necessarily think about what that's like integrating that medication into the person's daily routine. So there's a lot of statistics that show once somebody goes from 1 or 2 times a day med, you add in that third, adherence cuts down substantially for people who are self-managing meds, because now you've given them a complex routine, right? It's pretty easy for us to say, well, in the morning when I wake up and have my coffee, I can take my meds. And at the nighttime when I brush my teeth to go to bed, I'll take my meds. When you throw in afternoon, people are doing stuff during their daytimes, and that's where they can get really off. So I always like to say, do the med reconciliation, because sometimes there are different versions of that same medication somebody's taking, that instead of it being a 4 times a day pill, they can do a slow release that's 2 times a day. And that's something that a lot of people don't even realize in the medication world, because, hey, the doctor prescribed it, so we're going to fit it in. We're going to work with it. So I always encourage doing the med reconciliation for that sake. Just start with seeing if there are other options, especially if you're struggling with like a midday or multi-day solution to see. So the process is pretty straightforward. They just verify that all of the medications are correct. They're going to clarify that, hey, these are the ones we want you to take, because sometimes what we see, especially for people who aren't getting that support 24/7 or living in an environment where somebody's really overseeing them, is they had this doctor's appointment with maybe an orthopedic doctor and their regular doctor, and this orthopedic doctor gives them a med for the condition that they talked about, but they forgot to mention that they take all these other meds. And so now there might be that risk of medications interacting, especially for people who just, and I'm guilty of this, conveniently pick up our medications when we're at that hospital. We just select that pharmacy because that's easy enough to grab them while we're there. So we don't necessarily have a centered pharmacy that's reviewing all of our meds and making sure there aren't interactions. So there's the verification, then there's the clarification to make sure that everything's accurate and it is the appropriate medication and dosage based on the whole picture of medications. And then there's the reconciliation, which is comparing that medication list that's collected with everything and resolving those discrepancies, making sure that everything is appropriate. And then I like to add in the discussion, because that's something that you would lead or the individual or their support teams would, excuse me, sorry, would lead on talking through those kinds of things that I mentioned of, is there something else? Is there a slow release version of this? Or, hey, we tried this medication in the past and it didn't go well for the person, but it was prescribed again. Do you have any alternatives, right? One of the things that I always like, that I just wanted to include this in on this talk, is that you should feel very confident asking questions and sharing information about meds if you know them for the person that you're supporting. Just because the doctor prescribed it doesn't mean that they know the full picture and know the person, and that that's a guarantee this is the medication that needs to be taken. So feel free to always ask questions and share information that you have that might help with the process of determining if that's the appropriate medication. All right, so moving on to actually then the independence building, is it's important to establish routines with medication. I gave the example of taking your meds with your morning coffee and taking them at night when you brush your teeth. We found that, and a lot of research has found that when people take medications on a consistent schedule with a routine, one, it's more likely that the person's actually going to have that medication adherence. They're going to regularly remember to take the medications. But two, it also is very important for many medications to take them around the same time every day. Some medications are down to within 5 minutes to 10 minutes, that the sensitivity is that on, that taking it at an exact time, especially if you think about Parkinson's medications or some like antipsychotic medications and things like that, where timing is key. So establishing a routine can really, really help ensure that people are taking their meds at the same time, or at minimum around the same time every day. So then with that routine too, sorry, this is a little touchy to do it on the screen with you guys. Establishing the routine does not just involve the calendar, right? It's using solutions that are going to help the person, especially if they're taking multi-medications. We all know about medication organizers with little pill boxes. Those are phenomenal, right? That's a low tech solution. When I talked about many weeks ago, the low to high tech solutions, I always like to point to medication pill boxes as a low tech solution, because they can be phenomenal for somebody who takes multiple medications. You set them up, you know, I've got to take these meds at this time. Also, leaning on visual reminders, put it in a place that that person's going to see it and remember to take it, right? I mentioned the coffee. A lot of people will put their pill boxes right next to their coffee pot so that they remember to take it in the morning. Other people will put it next to their toothbrush, or maybe when they get dressed, right? Like whatever routines are going to be appropriate for them, having the medications in an area where they'll see it to have that reminder can be really effective as well. So then if those solutions are not enough, there is always additional higher technology solutions. So the first one that I wanted to start with, and probably the main reason you guys came here today, was to learn about different pill dispensers and technology solutions that exist. I put a note on here. These are just a few that are out there. There are more. There are even like very affordable ones that you can find off of Amazon, kind of off the shelf solutions. But these ones have the capacity for the majority of them to do not only multiple medication dispensing, sounding alarms to remind the person. Many of them have visual aids where they can use flashing lights. So if somebody who's deaf or hard of hearing still wants to rely on it, they can see that light to get prompts. But also many of these solutions have the ability to alert out to a caregiver. So they can indicate, hey, this person took their meds, this person didn't take their meds. Some of them can do things down to tampering. So I'll get into it a little bit. So the MedMinder over here, this very first one, this one is, they've updated, they just recently added this screen. But one of the things that people have reported on this one being successful is because it actually looks like a standard pill box. So it has that same look and feel. It's about this big. It's a pretty large device. So when we talk about having that visual prompt, that can be really helpful because people see it, right? There are some drawbacks, you know, and this is where I always say it is so dependent on the individual you're supporting with this to determine which is the best solution, right? I know many people, especially in the aging space, that do really well with the MedMinder because it's a familiar look and feel for them. Whereas maybe the Dose Flip or the ePill MedSmart might be something that somebody would select if they're more on the go. Those are portable devices that they can throw in a bag, they can take with them. It's a little bit easier to go about it. So the Dose Flip there, that actually is in a stand that allows somebody to be able to flip it into like a container if they're taking their medications. It also can come off of that stand. I'm giving you guys sizes. It's about this big. I like to say, like, think of a CD. So it's about the size of a CD. Or if you guys remember the compacts, or no, disc Walkman, like back in the 90s. It's like, it looks like a Walkman essentially. And this device was specifically designed to be able to work with the individual and the caregiver. So it has a lot of different notifications. And that's one of the benefits where some people will lean towards that. It also has the ability to alert out for tampering, or if somebody's trying to, you know, gain access to medications when they shouldn't. So that can be really helpful in the, sorry, hold on. Got to get my brain back on track here. with populations that maybe have a history of medication abuse or who are recovering in a recovery program where they're on medications that they have to be tracking. I know when I worked at DoseFlip, we did a lot of work with organizations that worked with mental health needs and things like that. So a lot of recovery and alcohol dependency or drug dependency programs. We even worked down to the level of drug courts where the devices could alert out and confirm that people were staying on track with their medications at the allocated times. So that person was more independently managing their meds and really gaining that access back to the community in a safe, controlled way. The Livy device and the Hero Health, these two are more higher capacity devices. So these two devices, they would sit more on your counter and they're looking more along the lines of like, almost, I like to say like a Keurig, like a coffee Keurig dispenser. And they really do have quite a bit more capacity. So if you're comparing it to the DoseFlip, if you've got somebody who takes just a lot of medications and you're going to need medications 4 times a day or something like that, these solutions can be a lot better. They all 4 of those ones, or I'm sorry, not the MedMinder, the DoseFlip, the Livy, and the Hero Health have the ability to do as needed medication dispensing, which can be really helpful as well. And then the ePill MedSmart, I included that one. That one doesn't have the notifications and alerts to families typically, but it is very affordable. And it's the only one on this list that doesn't have a recurring monthly cost. And that one it's just a little bigger than the DoseFlip. It's about this size. Maybe think like a smaller than a Frisbee, but about the size of a Frisbee, maybe a basketball circumference. And that one is available to just purchase straight up online. So those are some good solutions. As I mentioned, there are some really, really affordable ones from like Amazon and things like that that just have the ability to do the alarms and remind people, but it's all in one solution that people are having their alarms right then and there. They're taking the medication. It tracks that they took their medication and will close back up for the next one. So always varies. Additional tech solutions outside of just the medication dispensers themselves there are smart pill bottles. There are different companies that support smart pill bottles, and they can range from having like lights that this one that I have here will light up and remind people to take the medication, all the way to other solutions that just have a smart cap essentially. So it timestamps when the cap was most recently removed. So for people who are maybe taking a controlled medication or just don't remember when they took their meds last, and maybe it is those PRN meds, right? So like, I know I can't have Tylenol every 6 hours, but I don't remember when the last time I took it. I can look at that timestamp and say, okay, I took this 4 hours ago. I won't take any now. Or I took it 8 hours ago. I'm good to go. And then it re-timestamps when I most recently opened the bottle. Those can be really, really beneficial in situations like that. And then there are medication management apps. These range all across the board, from being able to send notifications and alerts to the phone to actually having total guides on which medications the person should be taking, what the outcomes are, what the side effects, right? It really, really runs the gamut for different medication management apps, depending on what the person needs and what's all that. Many people can track in the apps that they took their medications, and then family members can see if they've taken their medications regularly or things like that. Or it can be helpful for the individual themselves to see how frequently and how regularly they're taking their medications on their schedule. And then, of course, wearable devices. A lot of times people might respond well to those prompts that they would get from a medication management app on their phone, but maybe they're like me and they set their phone down and forget where they put it for a whole day. So it's not going to be super effective. So having something literally attached to your body is going to be more effective for you. You can get your prompts to your smartwatch or things like that, reminding you. And sometimes even with some of those applications, they can do things like take with water or take with food. They can have little messages along with the meds, even on those wearable devices. And then lastly, sensor-based systems. So there are a lot of remote support agencies who can integrate sensors maybe around a med cabinet or things like that, where they can indicate when somebody's going into that drawer and see that that activity took place. So for somebody who might not respond as well to some of these more integrated solutions, they're not going to respond well to an alarm. They're not going to respond well to an actual physical device or a smart pill bottle or something like that. Having a sensor-based system is a very passive system, but it can still track, and that can alert somebody to say, call them up and say, hey, I noticed you haven't taken your meds yet today. You want to go do that for me? And then they can confirm when that person goes in the drawer. So there are a lot of different solutions that can really, really help across the board and in different settings for the person's specific needs. I always stress this, and you guys have heard it many, many times with Shift, but finding the option that works the best for each individual person, because everybody is different. And that's kind of the fun with med management, right? Is there is no one size fits all solution for anybody. It's always working with them to determine what their goals are, what they desire, how can you assist in making taking their meds easier for them so that they can be successful in that. Awesome. Well, thank you. And now I'm open for questions, comments, concerns, anything.
I'll jump in. If no one has a question at the moment, I'll jump in with one.
Yeah.
So it's a little bit of a question, a little bit of a comment. So some of my experience as a provider, where we had multiple residents in an apartment, and they needed, whether it's 2 people, 3 people, each needed a pill dispenser or a medication management system, right? And you start putting some Frisbee-sized stuff around the house, and you run out of space. And it's not really a question. It's just something like, you do need to factor in the environment, and these do occasionally take up space that can be challenging. You don't have enough outlets or whatever it might be. And so I just want to kind of point out, they're not that you can overcome them, but just a thought about that.
I'll say from my dose days, we did see a lot more people in like community residential settings or multi-home settings or multi-individual supported in a setting, utilizing more of the dose flip, where they would be moving away from some of the bigger devices just because of that size and capacity. And I know at the time when I worked for Dose, which was 2 years ago, they were helping community residential settings actually do medication organizations for their cabinets. They would send out organizational tools and things like that that would pair with the devices. And kind of the fun thing, and I would encourage this for literally any device, obviously make sure you're not going to get in trouble if you're renting the device from the company, but they would actually sit down and have the individuals decorate their own devices to really differentiate whose was whose as well. And it also, what we found was a really positive interaction around meds, and started that really positive interaction to get the individual excited about being able to independently manage their meds and using their pill boxes on their own, which was really cool. So certainly you can, like Paul said, you can overcome it. We had many organizations that would run just like a power strip, because the dose slips at least didn't use that much power to run them. And they'd put that in a med cabinet and then keep them all plugged in and organized just in one space. But obviously it varies depending on the situation, depending on the individual's needs. And if that individual wants to have that device in their bedroom, and if that's safe for them and appropriate for them, then you can also help with organization that way, as if each person has their own pill box and it's appropriate, you can have the varying sizes and it doesn't impact total home space or total med cabinet space in general.
A couple other questions that came in, Alaina.
Yeah.
So one from Laura along these same lines. So are there any medication management platforms that are multi-resident, or are they all one per person? That's a great question.
They're typically all one per person. There are some in development. I think Improve on Health is developing more of a strip manufactured one that'll dispense stripped packaging meds. But I still even think with that, it's going to be per individual. I don't think that they can do mixed based on individuals or multiple individuals in a home. So nothing that I'm aware of currently.
And Brad, you have your hand raised. And just a reminder to everybody to please stay on mute if you're not actively asking a question. Thanks.
Yeah. All right, Paul. So, Alaina, so I've got a couple questions here. So, I know there's different brands, but basically we can look at an initial. So, is there an initial cost for all of the units, or some are just per month rental? How does that work? And then, as far as like the pharmacy refills, I've heard that like the pharmacy can just, I guess, mail you the refills to plug in. So I'm assuming that's a cost. And then my last part of the question really is, I guess, to any of the members from the passes that are joining us today is, are the initial costs, the rental costs, and the pharmacy refills all going to be covered under waiver? And are there any other additional costs that we need to consider as far as going this route?
So all great questions I can answer, and then I'll let the passes answer. So it depends on the medication dispenser. A few of them just have the monthly cost, and that is one of the things that I hear commonly for consideration is some of those rented ones can be really, really nice for folks, because if they break, you just send the broken one back, you get a new one, and it's no additional costs to replace those. You constantly have the 24/7 support, all of that. So that's where that can be really handy. Some of them do have an upfront larger cost and then a lower monthly fee. So kind of balancing that and weighing that out of what is the likelihood of things getting broken in the home, what is the likelihood of needing replacements, to determine the overall costs down the line. One of the things just along the lines of covering costs that I think really the state is leaning towards language wise is the most cost effective solution is not necessarily the least costly alternative, right? So when you're looking at this, if you've determined that, hey, this is going to be the best medication dispenser for someone, they're going to be successful on this versus this one that's a little bit less cost, this is still the most costly one, because if you get that for them and they don't use it, it's going to be just a wasted cost, right? So that's something that we're working with DHS. And honestly, the passes haven't gotten a lot of guidance yet on the newer language and the newer guidance that DHS will be putting forward. So I'll let them answer it if they can, but I don't know that they can yet. But then to answer on the pharmacy, it's totally varied based on the medication dispenser itself and the pharmacies. So there are some pharmacies that, typically what I found when I was working in the field was more of the local small pharmacies were more willing to do these what are called like unique fills, and filling these kind of unique setups that they could then easily translate into the medication dispensers. Some of the larger scale pharmacies like CVS and things like that, they won't stray from what they already offer for med management fill types. So that's where, like, I didn't have it on here, but Improve on Health does the blister strip, or sorry, not blisters, but those strip packaging dispensers. That can be sometimes more effective because you can partner with a more large scale pharmacy and use the pharmacy you're already using the way they already administer and fill the medications in that regard. And then it also depends on the pharmacy if they're going to charge extra. Some pharmacies don't, some pharmacies do. I don't think typically that translates up to the medication dispensing company themselves unless they have their own internal pharmacy where they're then filling the meds, and then that would be an additional cost. But typically, if you're just getting the medication dispenser from them, you're not going to have a cost from them for the pharmacy fills. It would come directly from the pharmacy if that's something that they wanted to charge extra for.
So then will the pharmacy need to get in touch with the dispenser company to get packaging, I'm assuming?
Yeah, so typically what I saw is that actually, like, if you were like, hey, I really want to use this device, I would ask the vendor to do the heavy lifting instead of the pharmacy.
Okay.
Ask them to reach out to the pharmacy that you want to work with and see if they can form a partnership for that pharmacy to do fills. You can also go vice versa. It really varies. If you let the pharmacy know ahead of time that, hey, I'm interested in this solution, so they're not blindsided if that company is reaching out, that usually goes a little bit better.
Okay, great.
Yeah. And does anybody from the past that's on the call want to address that or have any inkling of an idea yet for Brad's initial question about coverage? Yeah, I was going to guess that that would be hard to answer still at this stage, unfortunately. But for the sake of the pilot, anything with these recurring costs, just a reminder that you can bill that in advance through the end of December 2025. So you can get a little buffer space and a little room where that recurring cost is already factored and covered through the end of the year.
What's a typical cost
Hey.
for any of these? Is it as far as like the monthly cost? Because
Yeah,
there are
good question.
there are caps through waivers, so I'm just kind of wondering.
Mhm. So I
Well,
think
and real
they
quick,
range.
sorry,
Oh
it
yeah.
took me a minute to unmute. I didn't realize I had to star
Okay,
unmute.
were you able to speak
Star
in?
6 to unmute. This is Lauren Ground
No
with
problem.
Arkansas Total Care. I just wanted to add to what you were saying, that I think at this time, we really can't project what the language and the policy is going to end up being, so it's hard to speak on at this time. But just wanted to say that somebody is here listening and had a comment. It's just hard to unmute.
Thanks, Lauren.
Thank you. Definitely appreciate that. So I'm actually, and we'll share this PowerPoint out. I'm just pulling up the costs right now on some of the ones that I showed, so I can give you an idea, because I haven't updated my knowledge on their costs, and some of them make it obvious, some of them make it harder to find. So some examples: the MedMinder, that first one that I showed, it looks like they're $125 per month. The Dose Flip is $60 per month. The Hero Health device, I couldn't find Livy. The Hero Health, I believe, is one of the upfront costs, where they have a larger upfront cost, but then it's just so if you are a member, they've got a $29.99 per month fee for 36 months, or if you're not a member, it's $44.99 per month. But they do a risk-free 90-day trial. So if you're going to trial them, that's really nice to have. And definitely look into medication dispensers to see if they offer that. And then the ePill MedSmart, like I said, that one's an upfront cost, and that's $589.95. It looks like it's currently on sale, down from $695. But that one is just no monthly cost, just a one-time purchase. And some of those ones on Amazon that I mentioned are like 120. So they're, like I said, they're not nearly as robust as the other ones I highlighted. But if you need something that's just an alarm and just organize the pills and dispensing on a schedule, they can be really great for that.
Do they all come with apps that are connected to this dispenser?
Varies, definitely varies by the medication dispensing company. Some of them have apps, some of them have web portals where you're like accessing data on the back end. Some of them don't have anything like that. It's just push notifications and things like that you'd manage by contacting the company. So it's all varied. I think the majority of the more advanced systems do have either an app or a web-based portal.
Okay. Thank you, Alaina.
Yeah, absolutely. Thanks for all the questions.
And we do have a couple more questions to get to. My experience there as well, Brad, is that portal, so with the notifications that come in for a late or a missed dispensing, that sort of one view where you can get a kind of an overall health of the compliance in one screenshot is really powerful. Not only for reporting purposes and like overall tracking, but just for hey, it's 8 a.m. I'm just going to click on and make sure everything went smooth yesterday. And so I found it really helpful. They don't all offer the same, like a portal, and there's your mileage may vary, varying degrees of usefulness, but yes.
Okay, thanks, Paul.
So
yeah, thank you.
Another question in from Baxter, and I'd like to welcome Baxter as our tech champion from Arisa Health. You may have joined a previous meeting, Baxter, but I know you're relatively new to the position, so welcome aboard. Your question was, are there lockable med dispensers that can prevent them from being opened and all medications taken at one time? Great question.
Yes, absolutely. The vast majority of the ones that I showed, I think every one of them are technically lockable. The big consideration always is how lockable and how secure, because people can get creative and they can get into things, right? So I know some of them use lock and key. Some of them choose to use things like security screws and like specialty screws that screw in. totally varied. With some of them, I know the dose flip for sure has like tampering alerts, so a notification can go out if the lid is removed from the device, whether it's physically broken off the device or unscrewed and taken off of the device intentionally. So it varies across the board. What I would say is a really good starting place if you're just trying to figure out, especially from a security standpoint, working with and I'm going to totally draw a blank on it. Paul, remind me, who is the federal AT lab? What is the name here in Arkansas?
The ICANN or
Yes, thank you.
Yeah.
Yes, they can lend equipment and let you borrow it and trial it before committing to it. So it's a really good place to see if they've got different medication dispensers that you can test out different ones and get a feel for what is all out there and what's going to work best.
I'll just insert a quick plug. 2 weeks from today, ICANN Arkansas, which is a device lending organization within your state, will be doing the speaker series. So, all right.
I can't stress enough. I highly, highly, highly recommend taking advantage of programs like that. Those are, every state in the US has a federal assistive technology program. And so it is federal funds. It does not cost you anything to utilize them. They have a lot of goals to obviously be able to share and like promote assistive technology solutions. And it is just such a lovely, lovely way to dip your toes in the water with assistive tech and trial it before committing to it. Sometimes too, like on the pass side of things, they may say, hey, we want to know why this more expensive solution is better than this other one. That can be a really good way to paint a picture and show exactly why. You can say, well, we tested this one, here was the outcomes. We tested this one, and here were the outcomes. So just, I highly encourage you guys to come to that presentation with them and just to look into them on your own accord and start reaching out. They've got a really good, it sounds like reuse program as well, where they'll get used equipment and then can give it away for free. So really, really urge you guys to look into that program.
I have one more question, but I want to make sure the floor is open to anybody else who has a question for Alaina. Okay, I'll jump in. Forgive me if you touched on this earlier and I missed it, but do you have any experience with video verification dispensers?
Ooh. Yes. So there are some medication dispensing companies that will have where somebody sits in front of a screen to take the medications with an individual watching them, because those are maybe higher risk individuals who you're not sure that they're going to swallow, or you're thinking, hey, they're going to dispense them, but it's going to go right into the garbage or the toilet or something. So certainly that's an option. I actually wanted to look into the MedMinder a little bit more with their new screen, if that's a solution that they're offering with live video chatting. But I think in my experience, it's typically partnered with a telehealth organization and using an existing medication dispenser. There's one out of Minnesota, and I don't think that they've expanded yet, that does it where it's a fully integrated system. They use the dose flip integrated to get all of the data, and they can do the live video chatting. I believe, wow, I'm really drawing a blank on agencies' names. I'm so sorry. Paul, what is the agency that does a lot of the telehealth monitoring stuff? That's one of our vendors. Well, we'll figure it out. Oh, sorry, you're muted, Paul.
I'm equally drawing a blank.
Yeah, I think that they do some stuff with medication management as well. And then, like I mentioned too, with remote support, a lot of times people will set up a process with remote support providers where when it's time for them to take their medications, they will come over to like the tablet or video screen and take their medications just with the remote support provider watching. So you don't necessarily need a fully differential system that's going to do that. But if you're already working with remote support, that's a good way to support that.
So those are all the questions.
All right.
Been outstanding. Really appreciate Alaina, you taking the time to do this today.
Absolutely. Thank you for having me.
I'm going to do a quick share. Stand by just to let everybody know what's coming up next week before I turn it over to our guests. And so coming up next week, we're going to have our own Patrick Lane talking about monitoring privacy concerns and implications for your Human Rights Committee. And Patrick, you raised your hand right on cue. What's going on?
I was just making sure they knew who I was. So,
Gotcha. We know you at this point, Patrick.
just saying hello.
Awesome. And then, as I mentioned earlier, on the 22nd, Rick Anderson from ICANN Arkansas will talk about their the trial program for devices, their reuse program, and such. So definitely make sure you tune in. We're going to certainly record those, as we always do, and post them to the YouTube channel. And once again, thank you, Alaina, so much for the presentation today. So now I want to turn it over to Laura Mitchell from GrandCare Systems. And Laura has got the floor, and hopefully we have some great questions for her and her products.
Hi, everybody. I'm Laura Mitchell. I am a co-founder and the CEO of GrandCare Systems, and I am joined by Scott Feldstein, who is our US-based Director of Sales. So we'll try to give you the quick rundown of what GrandCare does in 5 minutes or less. well, we've got about 15 minutes. If you would like a full demonstration of the GrandCare system, or of course, if you're going to be at the Arkansas conference, we are going to also be there, and we'll be exhibiting and doing all the things. So I really appreciate you taking the time to listen to us speak today. So just a little bit more about what GrandCare does. GrandCare is a touchscreen based remote monitoring and remote supports technology designed to help people be more self-supporting, be more independent, and be more self-assured. So the touchscreen that you're seeing here is the centerpiece of the technology, which is customized to the individual's schedule, reminders, hobbies, and can connect them with loved ones and staff members.
Hey, Laura, your screen's not presenting anymore.
Let's try this again. It just stopped presenting, huh? Okay, let me.
You brought it up, and then I think Paul had brought up another screen to show who was going to be coming next week. So we just need to reshare.
There it is.
There we go.
Sorry about that.
You can see it.
Okay. Okay. So just a little bit more about the touchscreen. It's the centerpiece of the technology. It can be customized to that individual schedule and with reminders and hobbies. But it also is sort of a source of information. So it's a lockdown appliance. It's dedicated to only GrandCare. It is placed around the home. It's secure and encrypted, and all of the intelligence is stored at point of care. So it offers HIPAA compliant video chat where only whitelisted people can access, as well as whitelisted content. So folks can add YouTube videos that are locked down completely. They can't go anywhere else, but it allows that individual to sort of benefit from more of the social aspects. In addition to, if we feel like if we make it engaging and fun, then they'll continuously go back to the touchscreen and see that, what their daily schedule is and all those things. So I'm going to see if this video plays for you. Let me know if you get the sound here.
This is John. He's 25 years old. John used to live with his parents, but now he's out on his own. John used to rely on his parents to remind him to do all the little things he needed to do during his day, like teeth brushing and eating meals. But now that John is on his own, he uses GrandCare to provide these reminders and prompts. GrandCare even reminds him when it's time to take his medication. no matter where he is in the house, or if he's out and about. And when John needs anything, help is never more than a touch away. GrandCare helps John in other ways too. John's remote support team is always ready to help, and GrandCare notifies them if something needs attention. John loves playing the games, especially Bubble Popper. And he loves all of the videos. John is more independent than he ever thought possible, thanks to GrandCare and his support team. Want to know more about how GrandCare can help your organization? Book your free consultation now.
All right, thanks for indulging us in that. So we just we're not going to play that again. I just wanted to share a little bit more information about what GrandCare does. I thought that that video gave you a little bit of an inside look. Note that we also do have a variety of sensors that communicate with the GrandCare system. It should be noted that GrandCare is a software. So we're a software company. We've been around for over 20 years and we write the software. So we do not manufacture any of our hardware. This is a touch computer, and then these are Z-Wave and Innovonics and Bluetooth sensors that communicate with the touchscreen. It should also be noted that GrandCare empowers your team to remotely support your clients, who you know best. So GrandCare does not offer the remote supports itself. Instead, we offer the technology to provide remote supports. And we have a number of different folks that you can talk to that are successfully using GrandCare, including Brad from Easter Seals, who's on this call today, but a variety of other folks in case you want to reach out and talk to others who are doing the same thing. So GrandCare offers activity and health monitoring tools, one-touch HIPAA-compliant video chat, and a suite of alert parameters. So when you go online, you'll set a parameter saying, if this happens, then do this. If John doesn't get out of bed in the morning, then email, text me. If John doesn't access his medications, text him. If John doesn't access the fridge at mealtime, do this. If John doesn't check in on the touchscreen in the morning, there's a check-in button, then notify his on-site staff. Maybe you've got staff members that are sleeping. If somebody gets out of bed in the middle of the night, then email, call them probably, and alert them. So there's a variety of different rule sets that you can set up, and really comprehensive rule sets as well as reporting on the back end. GrandCare is set up so that they're placed throughout the home. So they offer support and reminders to the individual no matter where they are. So a kitchen touchscreen may offer recipe ideas, instructions on how to operate appliances and do the dishes. Bathroom touchscreens may offer teeth brushing videos, hygiene tips, how to shave. Bedroom touchscreens may have their medication prompts, daily wake-up check-ins, things like that, other personalized reminders. So all the touchscreens can be remotely customized to an individual's needs, their personal hobbies, to encourage engagement. And then, of course, set up one-touch video chat options for close friends and family and the support team. GrandCares can also video chat with other GrandCares as well. And so typically in a situation where an individual is living in a multi-resident housing scenario, each resident will have their touchscreen in their room, and then the common area touchscreens will be more common area related, how to perform chores, the chore list, maybe the laundry schedule, the house calendar of events, things like that. And so just to finalize here, I know we're just at about 6 minutes here. So we have some proven outcomes too. Clients throughout the United States have reported a reduction in on-site staffing, new revenue from being able to add new referrals, and then, of course, a quick turnaround in investment, improved satisfaction. So I just have a couple things here. Xavier University did a study that showed a 75% reduction in hands-on caregiving, obviously adding in those remote supports. A cost savings of about $2,653 per week, which is about $140,000 per year. And that was the LAD model in Ohio. Another Iowa-based customer shared that GrandCare saved them 1,440 hours of direct support care per month. And that was mostly being able to remove some of those overnights and replace them with remote staff. And then another Ohio-based provider reduced staff to client ratios from 1:6 to 1:21. So we've got some good, compelling results, and I would love to share more with you, and of course, open up the floor to some questions if you have any.
Laura, are these devices, I've seen them where they sit on a desktop or on a table. Can they be wall mounted as well? Is that helpful to save space that way?
Yes, great question. We do have a variety of different mounts that we recommend. One of them is a wooden box mount, popular in the LAD Smart House in Ohio, where it kind of is like a picture frame around it. But you also can do, there's a variety of Visa mounts where, depending on, what the usage is going to be, if they're using it to play games, we have a variety of fitness videos and yoga videos and meditation and things like that. So depending on the usage is where you might mount it. But great question. They can place it or mount it. And in fact, a lot of folks do mount it.
Also, I had a chance to experience a smart home in a provider I was affiliated with, ChemCrest in Pennsylvania.
Yeah.
Okay, you're familiar with that one.
Yep.
And, it's very GrandCare driven. And I don't know if do you know that one well enough to just sort of talk about what they may have set up there and how your device works in that scenario?
Sure. I mean, we can talk about any of those types of things. First of all, I wanted to see, I don't know, Brad, if you're still on and available, if you wanted to share a little bit about what you guys are doing, because you guys have a bit of a different setup.
Right. Yeah. So yeah, I'm happy to share. And I think a lot on the call have actually already come down and taken a tour. We had a ribbon cutting back in April. And we also gave a tour to some other folks, a part of this grant, a couple of weeks ago. So if anybody wants to come down and see our roommate housing set up in Little Rock, just get with me and we can do a tour there. But we have GrandCare screens in the common areas and in the bedrooms. We actually do video verification of medication monitoring for at least one of our individuals there. So that's a great way to do medication monitoring that way for those that are more independent but need that verification. The GrandCare really is the hub for all of our technology because it connects all the technology together. So we have, we've got the ceiling sensors, we've got doorbell cameras, we've got locks, we've got all kinds of stuff and just different things set up to where, as Laura said, if they do something, you get alerted. If they don't do something, you'll get alerted. So we're actually having fun kind of learning through that process. It's still pretty new to us because we've only been doing this for probably, I guess now getting into our 8th month. I will say one of the best things that's happened so far is that when we had tornadoes going through Little Rock earlier this spring, we were actually able to engage with our folks that were in the apartment complex. We were actually able to push a call through to make sure that everybody was getting in their safe space because the tornado, as we watched it on TV live, was getting ready to go right through the Palisades apartments. And so luckily it did not, but we were able to make sure that everybody was in their safe place and took their precautions. So just a really cool system. We actually have individuals that actually connect through their GrandCare system on site. So they'll actually video chat each other. And so we have different parameters that we can set up because we do have one individual that is very techish and he might actually become a part of our tech team. But he's actively trying to hack into things and he hasn't, but he's very interested in tech. So anyways, if anybody has any questions, they want to see more about our GrandCare touchscreens, just give me a call or send me an email. Would love to share.
Thank you so much, Brad. Does anybody else have any questions for us? We certainly didn't have time to go through, obviously, all of the features of GrandCare, and we are happy to do that with you, whether you want to set up a little demo or if you want to just come and visit us at the Tech Expo that we're going to be at. I assume a lot of you will be also there.
Laura, I just wanted to add one other thing and first of all, hi, Alaina, Brad, Dayton, everybody. Good to see you all. But I just wanted to add one thing is that when I got up this morning, a couple hours ago, I got a med reminder right through my GrandCare. And that's because everyone who works at GrandCare has GrandCare in their home. A lot of people know that, maybe some don't. And my med reminder is just on screen, like a reminder like you see there on the screen, without a sound, because I don't like things beeping at me, but that's just me. Other people can elect to have a sound associated with it too. So I just wanted to throw that out there that we do med reminders on GrandCare. And of course, we do, med video visits, right? Hey, Scott, it's time to take your medication. Why don't you come and go get it and we'll do it together, right? So some people will need that level of med minding as well. So we provide for that too.
Yeah. I think Paul has more information on the Tech Expo. I can also send anybody the information, but it's being put on by this organization for the Tech Expo.
Yeah, absolutely. So good question, Kristen, in the chat. The Enabling Technology Summit is going to happen on November 18th and 19th in Little Rock. Our team is beginning to do outreach to all of the stakeholders involved. Within the next week, you'll be getting, if you haven't already, gotten some information about how to register for the Tech Summit. It's going to include vendor displays. We're going to have sort of a uplifted speaker series where we'll have folks from all over the country coming in to speak about the current state of enabling and assistive technology, trends that are happening. In addition, you'll have the opportunity to interact with the vendors who are there. This is going to be open to members of DHS, it's going to be open to employees of the passes, it's going to be open to providers, it's going to be open to the providers' members, families, caregivers, self-advocates, associations throughout the state. So this is our first, obviously, Enabling Technology Expo, Enabling Technology Summit, and it's really going to be a big bang, I think, to bring all of these folks together who are interested in the tech aspect of assistive technology and helping you navigate how to make it happen. So we are up against the time, and I want to thank both Laura and Scott from GrandCare and appreciate the information that you shared. And also we will be getting out your contact information. I know you put it in the chat, but we'll be doing a follow-up to everybody with your contact information. So please reach back out to start learning more and more in depth about what they offer.
Thank you so much.
You got it. Thanks, everybody. We will talk again next week on same time. Have a good week.